Hey guys, this is Phil Gordon from Dental Implant Practices, and today we're going to review the Hahn Tapered Implant. This is going to be one of many reviews, so please stick with the channel for future coming events. First, I'd like to look at who Jack Hahn is. In the 1970s, he placed his first implants. In the 1980s, he co-founded the Midwest Dental Implant Institute. In the 1990s, he invented the Stereos system. Then in the late 1990s, he invented the Nobel Replace implant. And then in 2015, with the help of Glidewell, he introduced the Hahn implant. So that's a little bit about Jack Hahn. We're not going to go into greater detail. I just wanted to give you a brief update of why the system's named after him and who he was. Today we're going to dive into the manufacturing, the packaging, and the implementation of the implant. The Hahn Tapered Dental Implant is made in Glidewell Laboratories, specifically Prismatic Dental Craft. That's the subdivision of their implant company, and that's in Irvine, California. A little bit about Prismatic Dental Craft. In 2006, they were founded by Glidewell. In 2011, they started making mini implants. 2012, they started the inclusive line. And then in 2015, they launched the Hahn implant line. Let's go ahead and look at the Hahn implant up close and how it's packaged. We're going to run through some of those unique characteristics. So what I like about the implant is the high primary stability, and that is achieved through the aggressive buttress threads right in this region here. Also, it comes through the tapered body as the implant is tapered as it goes down, so you can compress it into the osteotomy site. And there's the dual lead thread pattern with the self-tapping grooves at the end, which allow you to insert and torque that into soft bone for high primary stability. So these features on the implant make it ideal for immediate implant sites, and they make it ideal placement for almost any osteotomy in the mouth. What's also great is the machine collar at the top of the implant, which is right up in this region here. It is a machine collar, it's not polished, so that bone cells will integrate to it. However, if left exposed and or if there's bone loss, the machine collar will be nice and soft tissue friendly for long-term maintenance, reducing peri-implantitis. In addition to that, there are the coronal microthreads right up here in this region right here for crustal bone preservation. And then you move into the sharp buttress threads for primary stability. So the machine collar, the microthreads, the aggressive buttress threads, the self-tapping dual thread pattern at the apical portion, in addition to the conical connection and the platform shift in this region here are what make this a great ideal implant for general dentists placing implants in all areas of the mouth and restoring with various types of restorations. The implant itself has a color-coded internal section, so it has a light blue for the 3.0, it's got a purple for the 3.5, it's got a yellow for the 4.3, blue for the 5.0, and I think green for the 7.0. That's an anodized property that it has so that it makes it easy to line up prosthetic and surgical parts. And with the available sizes from 3.0 to 3.5 to 4.3 to 5.0 to 7.0, it has an available offering of sizes from anywhere from a lateral to a central to a premolar to a molar and media extraction sites. It has lengths available from 8, 10.0, 11.5, 13 millimeters, and 16 millimeters. So it has a wide offering of sizes in width and length, which make it a great implant option. So there's basically an implant for every spot in the mouth. So what I want to move into now is the surgical kit here that the Hahn implant offers. Here we have the starter pilot drill, which is the 1.5 millimeter. Then we have the 2.0 starter drill. Then the 3.0 osteotomy drills, the 3.5 osteotomy drills, the 4.3, 5.0, and 7.0. What's nice about the Hahn kit is they have a size of drill for every implant placed. So if I were drilling to the 3.5 by 13 millimeter implant, I might start with the 1.5 and the 2.0 drills going to 13 millimeters on the lines, and then start with the 3.0 by 13, increasing your osteotomy with the side cutting burrs here. And then I would move over to the 3.5 by 13. And it's nice that the implant drill is the exact same size as the implant placed, and it's color coded so that the purple line on there lets you know it's a 3.5 for the purple implant, which is 3.5. So there's an exact drill for the implant placed, which is nice, so the surgeon doesn't have to be looking for laser lines on the implant drills. They can just focus on drilling to the angle and full depth of the drill, knowing that then they can place their implant. In addition to the drills, there are drill extensions so that you can lengthen the burr on the ratchet. There's also a adapter for the hand driver and or the torque wrench. When you place the adapter in the torque wrench, then you can use the adapters for the implant drivers. and then drive the implants with a torque wrench. You can also use that same adapter maybe to place your implant by hand at first. If we're lining up an implant, you can start placing your implant by hand, placing it in, and then switch over to finishing to the torque wrench. On the torque wrench, there are values. You can change the values of the torque, Newton centimeter, as low as 15 Newton centimeter. You can crank it up to 20, 25, 30, 35 is what I normally try to set at, and then it will lock out at that Newton centimeter torque. You can take it all the way up to 60 Newton centimeter with this. And then in addition to that, there are the paralleling pins and bone taps or drill taps if necessary. So this is the freehand surgery kit in completion here, and it's a very comprehensive kit and has all the things necessary for freehand surgery. Okay, this is the prosthetic kit, which comes with the implant system as well. In the prosthetic kit, there is another torque wrench for torquing down implants or healing abutments or final screws. In here, we also have a finger adapter so that you can line up your short driver and or your long driver, which is a star end, which shares the similar end as the Nobel. So it's a star tip for the cover screw and the healing abutment and the final torque screw values. So you can place the adapters in the finger torque and torque them down with the finger, and or you can place the adapters straight in to the torque wrench and place them with the torque wrench as well. This also has the adaptable torque settings on it from 15 Newton centimeters all the way up to 60 Newton centimeters, so that you have precise control over the torque values when placing your abutments and your final restorations. These both come in nice autoclavable kits that can seal down and be reused for sterilization purposes. Now we're going to look at the Hahn Tapered Implant packaging. It comes in these little individual packs. On here it has the anodized color. In addition to that, it has the size of the implant, Hahn Tapered Implant 3.5 by 13 millimeters. Okay, these are produced, packaged, and shipped from Irvine, California. To open the package, you can just tear off the plastic here, and in there it has a detailed instructions for use and this package here. Okay, the implants come packaged with a cover screw. You can see it's anodized as well, so everything in here is purple, which lets you know it's the 3.5 millimeter implant. The implant to open on the back just has a little rip open seal that we're opening here. So you would open the seal this way. Obviously you would want to do this with gloves in a sterile area. And the implant comes in this little titanium anodized carrier. You can see here that the implant is kind of being held in place by the carrier. And to pick up the implant, you would have your implant driver. You would insert it into the implant here. And there's going to be a little click. And then you pinch these prongs right here. And that releases the implant. Now you have the implant on the driver, still sterilized, to then take into the patient's mouth. So it comes in this little pinchable carrier. If by some chance we needed to put it back, we could place it back in here and pinch it, and then we could release the driver and the implant together. In addition to having the implant in there, as I said, there is a cover screw which comes with every implant. As you can see, the anodized color of the purple lets me know that it's a 3.5 cover screw, and the healing abutments, as seen here, are packaged separate. So the healing abutments and then the impression copings are packaged separate, because you may want to have different sizes of healing abutments, being 3 millimeters tall, 5 millimeters tall, or 7 millimeters tall, and various degrees of implant impression abutments. You may be taking, you might need a short implant abutment, you might need a longer one, you might need a closed tray or open tray, or you might be using CAD cam. So they have flexibility on these, which is why they're packaged separate, but at a minimum, every implant comes with a cover screw. So what this means for the general dentist placing implants is there's versatility, knowing that there's different sizes of implants for every spot in the mouth. There's efficiency in the fact that there's a simplified drilling protocol and a simplified prosthetic protocol. There's the precision of the conical connection and the compatibility with other systems. And then there's the stability of the implant with the high torque value that you get upon insertion, the high primary stability, and the seal at the top gives it a good versatility and a good option for a general dentist placing implants. In addition to the hand-guided surgery, there's also the fully guided implant system line that Glidewell also offers. And it's basically just an expanded version of the implant kit. And I like this guided kit because it is truly fully guided, meaning you can do your drilling and placing the implant through the surgical guide. And I also like this kit because there's no keys or handles involved. So when you're drilling a 3.5 by 13 millimeter implant, you take your implant osteotomy drill and you drill all the way down until the implant drill hubs out and stops at the top of the guide. There's no keys or inserts you have to put. It's just the drill going through the guide to the exact depth. And there's a drill for every implant size, diameter, and length. So it's got a nice drilling protocol similar to the freehand, except there's a couple more things here. There are tissue punches. So there's a tissue punch for the 3, 3-0, 3-5, 4-3, and 5-0. And then there is the aligning drill, which is basically a shorter drill, which allows you to get a start. And then you can go right into your pilot drills and or your full length burrs. So if I was drilling a 3.5 by 13 millimeter implant here, you could start with the tissue punch, which is just a way to remove the soft tissue if you're not laying a flap. Then you can move to your aligning burr, which basically gets a little drill osteotomy started on the crest of the ridge. Then you could move right into your 3.5 by 8. You could go to 10, or you could just jump straight to your 3.5 by 13. And by drilling straight to your depth and length here on the full hub, that would give you your osteotomy controlled angulation and depth. Then after that, you could place the implant mount, and the implant gets placed on the mount, and then you would screw this little access screw down, and then you carry the implant to the osteotomy site on the implant mount. You can carry that through the adapters and or through your implant drill and place the implant on the mount through the drill guide. You can place it to the exact depth and you can place it to the exact rotation based upon the hexes here. So it's got the availability to have full control over the implant depth and rotation. So in addition to having just the normal drills in this kit, what I like about this kit is it has a soft bone protocol and a dense bone protocol. So the soft bones slightly undersize your osteotomies if you're using those in the maxillary arch where the bone is softer and you want higher torque values upon insertion. And the dense bone is true to size so that if you're placing in the mandibular arch where the bone's a little denser, you can have the osteotomy be the exact same size as the implant while still achieving high primary stability. This is another nice feature of the Hahn kit. They have a fully guided implant system with them, okay? I also want to cover one other nice addition that they have. They have their own osteotomy kit. What's nice about the osteotomes, it allows you to expand the bone and manipulate the bone in a way without cutting it. So if you're working in the upper arch and there may be limited bone, or you're not wanting to remove bone with bone drills, you could make a pilot drill, a 2.0 or 3.0, and then introduce the osteotomes. What these are they are preformed metal in the shape of the implant so that you can insert them into the smaller osteotomy and start to stretch and increase the width of the osteotomy. And they are laser marked or indexed with the 8, 10, 11.5, 13, and 16 millimeter markings. So one could start with the 3.0, expand the bone, then move up to the 3.5, insert this and slowly expand the bone over time. Then you could jump up to the 4.3 or even the 5.0 if need be, expand the bone to the ideal width and depth with the exact contours here, and then place your implant in high stability knowing that you haven't cut away any bone and you have more available bone for implant stability. So this is a great additional kit, not one that you use all the time, but it's definitely nice to have in the toolbox. So thanks for watching this. I really appreciate your thoughts on this, so please leave me some feedback on the video. For more products or information, please go to www.dentalimplantpractices.com, which is my main website, and or listen to me on the Dental Implant Practices podcast. Thanks.